Hair transplant surgery starts long before you step into the operating room. The journey begins in the consultation room, where you sit down with your surgeon to discuss your goals and expectations. It's a conversation that's as much about your desires as it is about your medical history. Every detail matters to ensure a smooth and successful procedure. Next, your scalp enters the spotlight. Your surgeon will assess its condition, taking note of the density and distribution of your hair. This evaluation is a crucial step in deciding the best transplant method for you. It could be follicular unit transplantation or follicular unit extraction, each with their own set of benefits. Once the method is decided, it's time to plan the transplant design. This is where the artistry of the surgeon comes into play. They'll strategically map out where the hair follicles will be placed, ensuring a natural and pleasing result. It's not just about filling in the gaps, it's about creating a hairline that complements your facial features. Now, we can't forget about medications. Some, like blood thinners, may need to be halted temporarily. These medications can increase bleeding during the surgery, which we want to avoid. Your surgeon will guide you through any necessary adjustments to ensure your safety. This pre-operative preparation is not just a routine step. Rather, it's a dance of collaboration between you and your surgeon, each move meticulously choreographed for your unique needs. It's about setting the stage for the main event, where your surgeon's skill and your patience will come together to bring about a transformation. Proper preparation is essential to ensure the success of the procedure. It's about understanding the process, setting realistic expectations, and making informed decisions. It's about giving yourself the best chance for a successful hair transplant, a chance to reclaim not just your hair, but your confidence as well. Now let's dive into the heart of the matter, the surgical procedure itself. It's a day of transformation, and as you step into the clinic, you can feel the anticipation. But don't worry, you're in good hands. Your surgical team has prepared meticulously for this day. Upon your arrival, you'll be shown to the operating room. Here, the environment is controlled, sterile, and designed for your comfort and safety. The first step in the procedure is the administration of local anesthesia. This ensures that you remain comfortable and pain-free throughout the procedure. It's normal to feel a little nervous at this point, but remember, your team is there to support you every step of the way. Next comes the harvesting of hair follicles from the donor area. It might be the back or sides of your scalp, where hair growth is still robust. There are two techniques for this: follicular unit transplantation, or FUT, and follicular unit extraction, or FUE. Your surgeon will have discussed the most suitable method for you during your pre-operative consultation. In FUT, a strip of scalp is removed from the donor area, and the hair follicles are extracted from this strip. While in FUE, individual hair follicles are directly extracted from the scalp. Regardless of the method chosen, the goal is to obtain healthy hair follicles that can be transplanted into the areas of your scalp where hair is thinning or absent. Once the follicles are harvested, the transplant phase begins. This is where the artistry of your surgeon really comes into play. Each follicle is carefully placed into the recipient area according to a pre-planned design. This design is tailored to you, taking into account your hair growth patterns, the shape of your head, and your personal goals for hair restoration. The aim is to create a natural-looking result that enhances your appearance and boosts your confidence. This meticulous process ensures that each transplanted follicle has the best chance of survival. Keep in mind, though, that patience is key. Hair growth is a slow process, and it can take several months before you start to see the new hairs growing in. In the next scene, we'll talk about what happens after the surgery, the post-operative care phase, which is just as crucial as the surgery itself in ensuring the success of your hair transplant. So stay tuned for that. After the surgery, the focus shifts to recovery and care. The journey doesn't end when you leave the operating room, but continues at home with diligent post-operative care. This step is as crucial as the surgery itself and plays a significant role in achieving the desired results. Upon completion of the procedure, you'll receive detailed instructions from your surgeon or nursing team on how to care for your scalp. These guidelines typically cover aspects like medication, dressing care, hair washing, and physical activity. In the initial days following the surgery, it's not uncommon to experience some swelling, discomfort, or redness in the treated areas. This is a normal part of the healing process, and these symptoms usually subside within a few days. applying cold compresses and taking over-the-counter pain relievers, as advised by your surgeon, can help ease these symptoms. One aspect that often concerns patients is hair washing. Yes, you can wash your hair after a transplant, but it's essential to do so gently and only with the products recommended by your surgeon. Avoid rubbing or massaging the scalp, as this can dislodge the newly transplanted follicles. Physical activity is another area that needs attention. While light activities can be resumed within a few days, it's best to avoid strenuous exercises like weightlifting or high-intensity workouts for at least a few weeks. This is to prevent any undue stress or damage to the healing follicles. Regular follow-up appointments with your surgeon are a must. These visits allow your surgeon to monitor your recovery, assess the progress of your hair growth, and address any concerns you may have. Remember, every patient's recovery journey is unique, and it's important to follow your surgeon's advice tailored to your specific needs. In the end, remember that patience is key. Hair regrowth after a transplant is a gradual process, and it can take several months to see the full results. But rest assured, with proper post-operative care, your efforts will pay off. Proper post-operative care is vital to achieving the best results. So, take your time, follow your surgeon's instructions, and look forward to the new growth that's on its way. As with any surgical procedure, hair transplant surgery carries some risks. While it's generally considered safe and complications are rare, it's important to be aware of potential issues that could arise. Infection is one such risk. Although it's uncommon, there's a possibility that the transplanted area or the donor site could become infected. This is why it's crucial to follow post-operative care instructions diligently. Your surgeon will provide you with specific guidelines on how to clean and care for your scalp to prevent infection. Bleeding is another potential complication. While some minor bleeding is expected during and after the procedure, excessive or prolonged bleeding could signal a problem. If you notice any unusual bleeding, it's important to reach out to your surgeon immediately. Scarring is also a potential risk, particularly with the follicular unit transplantation method, which involves removing a strip of scalp from the back of the head. While the surgeon will do their best to minimize scarring, some patients may still have visible scars after the procedure. In rare cases, the transplanted hair follicles may not take, and hair growth in the transplanted area may be less than expected. This is why it's important to have realistic expectations about the results of the surgery. Now, while these complications may sound alarming, remember that they are rare, and the majority of patients undergo hair transplant surgery without experiencing any major issues. The key to minimizing these risks lies in the hands of a qualified and experienced surgeon. A good surgeon will not only perform the procedure with the utmost care, but they will also provide comprehensive pre- and post-operative care instructions. Furthermore, they will be there to support you and answer any questions you may have throughout your hair transplant journey. So do your research, ask plenty of questions, and choose a surgeon that you feel comfortable with and confident in. Understanding the risks and choosing a competent surgeon can help minimize potential complications. In conclusion, hair transplant surgery can be a life-changing solution for those experiencing hair loss. It's a systematic process that involves careful pre-operative preparation, during which your goals and expectations are discussed, medications may be adjusted, and a transplant design is planned. The surgical procedure itself, whether done through follicular unit transplantation or follicular unit extraction, involves the harvesting of hair follicles from a donor area and carefully transplanting them into the recipient area. Post-operative care is just as crucial, ensuring you follow detailed instructions regarding washing your hair, avoiding strenuous activities, and attending follow-up appointments. Like any medical procedure, hair transplant surgery carries potential risks, such as infection, bleeding, or scarring. However, these complications are rare, and diligent post-operative care can minimize their likelihood. With proper understanding and preparation, you can navigate the process of hair transplant surgery with confidence.